Fibromyalgia is a serious medical condition. Fortunately, there are a number of non-traditional medical therapies that can provide significant relief and improvement in quality of life. Why non-traditional therapies? Well, as Frank Zappa once said, without deviation from the norm, progress is not possible. Fibromyalgia affects a significant number of people, well over 6 million per year, and greater than 90% of these are women. It is primarily found in technological societies, and although the exact mechanism is not well understood, it is believed to be the result of some sort of neuroendocrine dysfunction. Although the initial diagnostic criteria for fibromyalgia were quite limited, it is now considered to be evident if a patient experiences chronic widespread pain in association with fatigue and allodynia, which is a heightened response to pressure. There is also a substantial cognitive decline in patients with fibromyalgia called fibrofog. Fibrofog can make doing activities of daily living increasingly difficult. Patients also experience significant sleep disruption, and most cannot get into the real deep level of sleep. Fibromyalgia is also associated with irritable bowel syndrome, headaches, rashes, dry eyes, anxiety, depression, impaired coordination, ringing in the ears or tinnitus, as well as Raynaud's syndrome. Traditional therapies for fibromyalgia include antidepressants, the use of nonsteroidal medications, the use of medications such as Neurontin, light exercise, and muscle relaxants. In addition, a number of medications have recently been made available for fibromyalgia. However, none of the current medications are universally effective for all patients with this illness. In non-traditional medicine, the armamentarium for the treatment of fibromyalgia is quite extensive. There is good medical evidence to indicate that acupuncture, 5-HTP, massage, and magnesium can be effective at reducing the symptoms of fibromyalgia. Also, exercise such as Tai Chi, yoga, and Qigong have been shown to be beneficial. Natural anti-inflammatories such as cat's claw and devil's claw may also be effective for some. Hormones such as melatonin can be effective, as well as vitamins B12 and B1. As always, good nutrition makes everything better. Unclear but anecdotally positive results can be found in the chiropractic literature, as well as mind-body therapies and hypnosis, energy healing, hyperbaric oxygen, and even dietary supplements such as S-adenosylmethionine and DHEA. Intravenous B vitamins in 2 clinical trials have been shown to be beneficial at reducing many of the symptoms of fibromyalgia. B vitamins are involved in the production of serotonin, and it has been theorized that higher serotonin levels help to reduce many of the fibromyalgia symptoms. Although optimal levels of B vitamins are unknown, given intravenously, there seems to be a benefit. The first clinical trial of intravenous B vitamins in fibromyalgia was published in the medical journal Alternative Therapies in Health and Medicine in 2007. 7 patients with long-standing fibromyalgia had 8 sessions once a week of intravenous B vitamins. Over that period of time, the patients experienced a 60% reduction in pain, as well as an 80% decrease in the symptoms of fatigue. This chart demonstrates the pooled data from the 7 participants, showing a gradual decrease in pain levels over the 8-week period. This demonstrates the pooled data indicating a decrease in fatigue levels of the participants over the 8-week period. Many patients with fibromyalgia also may have abnormal thyroid function. They have many of the symptoms associated with a condition known as sick euthyroid syndrome, and these symptoms include fatigue and insomnia, weight gain or an inability to lose weight, dry skin, hair loss, and other symptoms of hypothyroidism. In these patients, their thyroid levels may be normal or at the low end of normal range or actually below the normal range, and almost universally respond well to thyroid supplementation. Many patients with fibromyalgia also have symptoms that are very similar to that found in leaky gut syndrome. Muscle pain, fatigue, changes in memory and cognition, headaches, irritable bowel, constipation or diarrhea, and there is also a strong association with autoimmune disease both in leaky gut syndrome as well as with fibromyalgia. The AltMed approach to fibromyalgia is rather unique. We use a combination of many therapies, including intravenous B vitamins. We also evaluate and treat for leaky gut syndrome and check to see if the patient also has sick euthyroid syndrome. Nutritional evaluation and recommendations are very important, and healing cannot happen without this. We also look at a patient's level of exercise and make specific recommendations on how to improve that. When needed, physical therapy can be done using the AltMed physical therapy program. We also use a lot of stress reduction therapies such as massage and acupuncture, and even several forms of energy medicine. Success with fibromyalgia with AltMed patients is higher than average, and most patients are able to regain a significant part of their life that they have lost to this debilitating condition.